This is Dr. Matthews. We are in Tolbuda District Medical Ayurveda Hospital of Tolbuda District of Idigi, Kerala. We are here to quickly ask for his experiences in Agni Karma. He is doing it pretty well and very good clinical success. So I will be precisely asking Dr. Matthews what are the most common indications that he finds the best utility with Agni Karma.
Agni Karma nowadays it is practiced widely by the practitioners of Ayurveda all over Kerala. See, as far as I am concerned, I am working in District Ayurveda Hospital, Tolbuda, as a medical officer, Marma. See, I am having a maximum number of cases with a history of trauma conditions, simple fractures, dislocations, sprains, and such things. And meanwhile, we have a lot of patients with repeated strain injuries. And the present scenario of regarding the occupation of the patient, repeated strain injuries like epicondylitis, carpal tunnel syndromes, and trigger fingers, and various types of tendinitis are very common nowadays. I found very difficult to manage such conditions with medicines alone. In such condition, I got some inspiration right from my colleagues itself, and I tried initially plantar fasciitis and got some success, and some cases were very good, had very good response with Agni Karma with proper medicines. And meanwhile, I tried this thing for the most common repeated strain injuries like epicondylitis, medial as well as lateral, and it was very success in the sense there can be recurrences, but it was of course give the patient a symptomatic response very quickly with the proper medicines. And now I switch over to carpal tunnel syndrome, tenosynovitis, decorvents conditions, Achilles tendinitis, and further to sciatic neuritis and radicular pain of cervical spine. In such conditions, in my experience, I feel that even though Agni Karma is not a complete treatment, but it gives the patient, so you can manage the patient well, comfortably, and with the minimum time of treatment and with minimum medication, with minimum expense. So that is my experience regarding Agni Karma.
We will also quickly cross-check the failures, if at all, have been found with Agni Karma, so that we are very realistic about the cure prospect as mentioned, at the same time understand that the limitations of Agni Karma, if any.
Yeah, of course, in diabetic patients and those who are having systemic diseases and disabled, crippled patients, it is better to avoid Agni Karma. And there are failures. Of course, even after doing neurosurgical decompression, they are also having recurrences and failures. Just like that, we are also having, even we are doing Agni Karma and proper internal medicines, recurrences are there. Especially repeated strain injuries. The patient, after getting some relief, again is going for the same type of work, and you have to advise the patient to adjust his job in such a way that to avoid straining such points.
So before we get into the real shoot of the patients, we will quickly note down the phone number of Dr. Matthews in case somebody is interested to clarify. And after, if at all somebody has to call, he will mention. We say this for the simple reason we want more people to be benefited of the experience of senior doctors like him, and we are happy to be instrumental in this. So Dr. Rajesh Kaimla is shooting at this moment. Dr. Joji is here back. I'm just speaking very informally. It's a very informal shoot. Just that the youngsters and maybe even middle-aged, even experienced doctors can have some things out of it derived. So we would be highly thankful to Dr. Matthews to tell his phone number and also the best time to call him if at all somebody has to call him.
See, of course, I am most welcome to contact me, and of course, just like anybody else in the Ayurvedic field, it is better to call me after 9 p.m. and my number is 944-72-670-65, and I am very thankful to Dr. Srijit and Dr. Rajesh and Dr. Joji, and I am a person who is most welcoming, especially my house surgeons. See, presently I am having one of my house surgeons, Dr. Amal is here, and I welcome all my house surgeons and junior doctors to have more ideas and to propagate this type of specialized treatments, not only agnivesh, any type of treatment. And of course, as I am working in Burma department, I am doing a lot of things with having traumatic conditions, simple fractures, dislocations, sprains, and this type of parasurgical procedures. Thank you.